Mexico is a first-class municipality belonging to the 3rd District of the province of Pampanga. It has a total land area of almost 12,000 hectares, composed of 43 barangays, and a recorded population of more than 140,000 in 2007. With its proximity to the city of San Fernando, the municipality of Mexico shares similar physical and cultural features, evident from its growing number of commercial establishments. Mexico's location turned out to be an advantage as it becomes the catch area for San Fernando's economic spillover. But if there is one thing that lets Mexico stand out, it is its leadership and political will. With Mayor Teddy Tumang taking on the helm, the town did not only have its share of economic development, it has also improved the quality of its constituents' way of lives. Most of the time, politicians dole out healthcare services by giving out sponsored PhilHealth cards. But in Mexico, health benefits don't stop there. Mexico's leaders did not only take it a step further, instead, they have taken it to a higher level by providing a holistic approach to its healthcare for the municipality.
Binibigyan natin ng malaking pansin paano natin matulungan yung mga kababayan nating especially yung mga mahihirap. Priority, yung healthcare.
Our local chief executive, our mayor, is very supportive with the health programs.
Its healthcare system is anchored on a two-pronged approach, the preventive and curative. Healthcare was since focused on improving the rural health unit's services and establishing the first community hospital in Mexico.
Itong community hospital, yan ang aking pet project. Maliit lang ang budget namin. Pero pagka gusto mo ang isang project, kahit na maliit lang ang budget, at ay binigyan mo ng malaking pansin. Kasi itong Mexico Community Hospital ay malaking tulong sa mga kababayan namin. Pag kami pilat sila, wala silang babayaran.
Maswerte yung mga Meksikano. Imagine, meron silang primary healthcare. Yung mga centers. Pagka kailangan ng hospital, meron kami community hospital.
Ang hospital na ito ay itinayo, hindi para mag-generate ng income. Pag pumasok kayo, parang pumasok na rin kayo sa mga elite na private hospitals in the province. This year, we are going to operate our own dialysis center, and hopefully, by the end of the year, the ICU complex will be in full operation.
Kasi nakita ko yun yung ICU dun sa St. Luke's. Siguro 90%. Parang pinattern na natin yung ICU dun sa St. Luke's. Meron din mga aparato yan, ventilator, yung iba pa, no? So dito, hindi kailangan ng pan-deposit.
The only funded na municipal hospital dito sa buong Pampanga.
Mexico has 4 RHUs, catering to 43 barangays. A tremendous feat considering the bulk and magnitude of its scope. But this did not hinder its municipal doctors on fulfilling their duties. RHUs are the LGU's frontliners for healthcare services, offering various primary healthcare programs to their constituents. Doctors schedule services to make things orderly and manageable. Each patient is thoroughly consulted and given proper medication, all for free.
Most of our kababayans or constituents, nasa yan? More or less, nasa poverty, below poverty line. Most of them patronize the RHU. Yung mga health center kasi, sila mga frontline services, napakalaki ng impact. Malapit ito sa place nila. Free yung service, free yung medicine.
Not a single centavo is being paid. If they are all available here, we give them all free.
But healthcare does not end once consultation and medicine is given. Doctors also make sure that each patient completes his or her prescription and gets a follow-up consultation as needed. The expanded immunization program is aimed at infants receiving complete vaccination. Pre- and postnatal checkup is also a continuous process that includes the mother and child. Consultations are done from conception to birth, where the mothers are given proper nutrition, including vitamins and the know-how on baby care, especially for first-time expecting moms. It also aims to lower the rate of maternal and infant mortality.
Yung pre- and postnatal check-up natin, primarily para sa buntis yun. Sa buntis at saka sa unborn child. From the start na ma-delay yung kanyang mens, magpa-follow up na siya nun. Titingnan talaga kung pagka-positive nung pregnancy test niya, every 2 months, tapos pagpadalas na every month. Pag malapit na talaga mga anak, every week na siya nun. Bibigyan din siya ng mga vitamins hanggang mga anak at pagkatapos din mga anak. Pagkatapos naman yung mga anak, pa-follow up pa rin yung situation ng baby, tsaka napapasok yung sa ating mga immunizations na.
Pregnant pa lang yung mother, we advise them already, once they deliver the baby, they would enroll the baby through the API. Infant morbidity are usually preventable through immunizations. So more or less in the API, we could incorporate solving the MDG4 and the MDG5. That is infant morbidity and reducing the maternal mortality and morbidity also.
After consultations, doctors in the RHUs and their teams go out of their units to conduct medical missions in barangays, bringing healthcare services directly to the people.
They also conduct a lot of field works. Most of our midwives going to their respective barangay, and they have to immunize all the qualified babies to be immunized.
Essential dental services like fillings, extractions, and checkups are also offered in health units. Laboratory services such as fecalysis, urinalysis, and other tests are done in the units as well, making it easier for doctors and patients to accurately diagnose illnesses. Providing these services gives a more complete health program for each Mexicano.
Yung rural health unit namin, lahat ng programs ng DOH, ni-implement namin.
I institute some other services like some minor surgeries, different procedures, OB and gynae. We also doing here.
Including the services, including the diagnostics in the laboratory, that is your sputum, your urinalysis, your fecalysis. We're doing it here. Aside from those, I want to include that we give dental services also.
Innovations are also being practiced in rural health units, specifically focused on senior citizens since they have special needs and extra attention.
Isa sa mga best practices that we have sa munisipyo natin, no? So noon ko pag ginagawa actually yung in-involve ko yung mga kamag-anak nila para at least maramdaman naman ng mga senior citizen natin, ng mga pasyente na hindi sila napag-iiwanan, na ando pa rin yung kalinga at saka pagmamahal ng kanilang mga kamag-anak. What they do is at least to keep the patient updated with the intake of medicines. They should be taken regularly and timely. This practice has been done for a lot of years already. I only hope that this practice is replicated in the different RHUs in the country.
Education of patients on various diseases, procedures, and obligations is also being delivered as well to promote different health programs in the barangays, like important information regarding tuberculosis and family planning. Mexico's leadership does not stop with the development of its RHUs. It has taken healthcare in Mexico to the next level. Considered as the most modern and well-equipped public hospital in Pampanga today, the Mexico Community Hospital was established to provide the best health services to its constituents and people from neighboring towns. It may be a public hospital, but it has a look and feel of being a private one. Fully funded by the LGU through its taxpayers, the hospital is equipped with state-of-the-art medical equipment. It has 3 operating rooms, 50-bed capacity ward, laboratory, dialysis units, and soon to operate are the intensive care units. In fact, the MCH has even had visits from representatives from different countries who consider it as a benchmark community hospital.
Maraming pumupunta dito na ibang bansa, na ibang bayan. Ilang bansa na ang pumunta dito. Ginagawang benchmark itong hospital natin. Tinuturo lagi ng taga-PhilHealth.
Mexicanos can now have a taste of modern facilities without having to spend as much. Instead of going to other towns to avail of hospital facilities, people can now stay in their community and avail of the best medical care the municipality has to offer. Amidst all commendations and accomplishments, there still is much to be done and improvements are still on their way.
May program kasi yung DOH na Health Facility Enhancement Program. Kasama to dun sa mga pwedeng i-upgrade ng DOH 2014. Gagawin 2 floors to. And then yung first floor, magiging siyang working home.
Yung ratio 3 of Mexico is one of their projects, no? Na nasa pipeline na yan, it will be constructed early next year. Kasi from 15 square meter, magiging ano yan, pag natapos yung health center na bago, it will be about 300 square meter.
Lumalaki ang populasyon natin, kaya kailangan na lakiin itong community hospital na to. Marami pa tayong plano dito.
Initiatives on improving the quality of its healthcare system is the embodiment of its strong political will, being enforced by its leadership. It also shows its strong promise towards uplifting its healthcare services, specially meant for its needy and less fortunate constituents. And with the support of various sectors, its community doctors and leaders, Mexico's healthcare program is now becoming a reality, an example of true commitment and genuine governance.
At serbisyo, tunay ang progreso.